Fade Away. Stick and stay. I was totally gutted last week when I heard of his passing. Oh boy. It's definitely not over. Forever in our hearts. Koda, your passion, your music, your message. Standing here only because you made your way. Right, there's nothing that's impossible when we stand tall.
And we're standing here only because
Joy 99.7.
Welcome to Ultimate Health on Joy 99.7 FM on the heels of that Coda song, and may he rest in perfect peace. So today we're discussing World Immunization Week. And this celebration heralds 50 years of the expanded immunization program. From 1974, there's been a globally coordinated program of immunization that has guaranteed that you and I can live well and healthy. Yeah. When it started, you gave birth to children not knowing whether they would survive, and probably you'd be looking up to God for Him to make a way. Immunization is serious business. I'm joined in the studio by Gladys Damale, right? She is with Hope for Future Generations. They do a lot of advocacy and work on immunization and other health issues. Next to her, I have Mrs. Eunice Joan Jagley. She's with the Greater Accra Regional Health Directorate. She's a Health Promotion Manager. Ladies, you're welcome to Ultimate Health.
Thank you, Nortey.
Right. And we've done immunization many times, but I don't think we've properly observed the World Immunization Week. So it's great to have you to educate us and inform us and ultimately transform us when it comes to immunization. But why is this so important? Let me start with you, Eunice. Why is this so important for us to mark World Immunization Week?
Thank you. You said in those days, we give birth and we pray for the children to survive.
Yeah.
On this note, I say good afternoon to our cherished listeners for tuning into Joy FM to listen for us to enter their home and see how we can work together to build a healthy community that will be happy and productive.
Right.
The African Immunization Week come as a result of the fact that immunization has been seen as cost-effective way of giving health to children to live beyond 5 years.
Right.
That was a problem some time ago. So if we have been able to make more children surviving, reducing the child mortality, then there's the need to put some premium on it and have time where society reflect and look at what we can do better, what we can improve upon, and how do we do it together.
Okay.
So the African Immunization Week is set aside to create awareness and then bring together stakeholders to discuss immunization, look at the gaps, see how they can do to fill in the gaps so that the coverages for immunization can be improved.
Okay.
And when that improves, it means we are also reducing mortality and morbidity
Right.
in children.
Okay.
So we can have more children surviving beyond the age 5.
Now, one of the things that caught me significantly whilst you were speaking was that you sought to make sure that we harness this week to prioritize issues surrounding and related to immunization, which essentially is a process where we protect a person from a disease, right? Before the disease occurs, right? So is it that over the years we've tended perhaps to take this whole process and the means by which it is achieved for granted? Is it that we do not pay enough attention to immunization, the processes, the means by which we protect our children? Is it that we take it for granted?
Thank you, Nortey. Yes and no.
Okay.
Yes, when we have a few who do not think it's important.
Okay.
Yes, when we have a few where they are located, they cannot be reached all the time. But when this time is at work, we make every effort to reach them.
Okay.
So in that case, we say we've taken them for granted. They are located in a part of the country.
So we have a duty to reach all people with vaccines,
During-
right, when available, wherever they are.
Yes.
Okay.
During this time. So we make extra effort to be able to reach. For example, people who are on the islands where to even have the boat to
Okay.
cross the health workers to the island is a problem. And when you look at the numbers at the various islands and the workforce we have, so getting them and ensuring that your staff are safe to the island
Okay.
prevents you from getting to them. But when it comes to the immunization week, there is extra effort to make sure that we get to them at wherever they are located.
Okay.
Those working at remote areas, quarry sites, mining sites, everywhere they are located, there is extra effort to reach them. Somebody will ask, why is it that it is only this time And what is the immunization at all?
Right.
Somebody will still be asking, why is it important? Yes, we all know that when we talk about immunization, it is when we use vaccine to prevent the body from being overcome by a pathogen that causes a particular disease. So these vaccines are introduced into the body.
Right.
Instead of we waiting for the pathogen or the germ or whatever that causes the disease to enter the body that can cause fatality, the vaccine is introduced into the body. Then the body develops the antibodies. So if on the unfortunate situation where you become exposed to the pathogen,
Right.
the body is well prepared now to fight. So in the worst situation where maybe it can cause death, you may have symptoms, but you may not die
Okay.
because the body had prepared very well to fight the pathogen.
Okay.
If you are to have symptoms per your body build up, now you can have it without having symptoms. So you'll be in good shape because your body will be able to overcome the pathogen.
Right.
So vaccination or immunization is just that process of we introducing vaccines into the body to prepare the body to fight diseases.
Okay.
And it can be oral, it can be injected, sometimes tablets.
Right.
Fine. So you ask whether we have taken it for granted or not. I would say a lot had gone into this vaccination. Ghana, as you mentioned, have been doing vaccination for the past 50 years. So we are part of those who benefited from the vaccination. And you and I will remember when measles was killing children like fowls.
Right.
Polio was so devastating. But for the vaccination, some children don't even know what is called measles
Never heard of it.
today.
Yeah.
They don't know what is called
Polio.
polio. If you see people leaping now, it's not because of polio.
Right.
You can see it in an age group, but not beyond there.
Okay.
So vaccine or vaccination have been helpful and they are cost effective. If you compare it to the cost of treatment and the fatality, then the most effective way of working around the conditions that vaccines have been prepared for.
Okay.
So looking at the benefit of vaccination to society, to individual, to family, the world realized the need, the public health world realized the need to actually set time aside where there will be reflection, where there will be extra effort to ensure that we reach everybody and society get to understand the importance of vaccination, that those who were not previously on the same page with propagandas of vaccination will now understand, ask questions, and make themselves available to enjoy the banquet.
Right. Okay, it's been served up. It's a buffet, but we're talking about vaccines. Huh? You just listened to Eunice Jagli of the Greater Accra Regional Health Directorate, she's a health promotion manager. We're observing, along with the rest of the world, World Immunization Week, which is the last week of April every year. 24th to 30th roughly here. We'll talk about what is being done as part of the observation, but I'm in the studio with Gladys Damalin. She's with Hope for Future Generations, an NGO, and there's a lot to do with regard to advocacy when it comes to vaccines, immunization, right? Even making sure that as a country we have the domestic or the local component of resources and funding that is required to procure and make available these vaccines, right? So there's a whole lot of dialogue and discussion that we need to engage in, and that's part of what the week is harnessed from. Gladys, you're with Hope for Future Generations. What is your linkage, and what else would you want to add with regard to the importance of this week and the observation? I know your organization has issued a press release, right? I think on the 24th, commending government but encouraging government to do more. What is your stake in this?
Thank you very much, and a very good afternoon to your listeners. Just to add to what Madam Eunice said, yes, immunization is very, very important. And for the past 45 to 50 years, we have all seen that it is cost effective and it saves lives. And so for us at Hope for Future Generation, we are looking at the domestic resource mobilization component of immunization, because if government is not able to allocate enough resources for this program, then it means that we will still have children who will not be immunized. And if we have children who are not immunized, then the whole population is at risk. And that is what we want to prevent.
Essentially, that means we're breaking the chain of protection.
Exactly. We are breaking the chain of protection.
Locally and globally.
Exactly. And we don't want that. I mean, we all saw what happened when COVID-19 came into the scene. You realize that, I mean, the one person within a community could get it, and before you realize, about 5 or more people are contracting COVID-19. And so basically, that is what immunization is all about, to protect us and protect the community and the country as a whole. And so if we don't have the necessary funding to make sure that this program runs successfully, then it's a big challenge for us. And over the years, we have seen that though government is doing its bit, donors are supporting. And we think that it is not sustainable. Because it's as if you have a daughter, and you are telling somebody that I can take care of my daughter or my son. I need somebody to help. And the person comes helping, and you want to just leave everything on that person. We don't think at a particular point in time that person may get fed up and said no.
In this analogy, you're referring to donors.
Exactly. Those who fund immunization in Ghana.
Us as a country, Ghana, to finance the procurement and other related issues to vaccinations or immunization. Okay. And you're suggesting to my listeners that there's a bit of a gap. And part of your advocacy is to make sure that government steps to the plate and also plays its part.
Exactly.
Okay. So there's concern about that, because if that, should I say, process or undertaking is compromised, then it means there'll be a gap in immunization.
Exactly. So let me give you an example, Nortey. So we have mothers, for example. I know somewhere last year, 2 years ago, we had some shortages. So you have mothers who would take their children to a health center and
for routine
immunization. And the nurse will tell you that this particular vaccine is not available. So I visit the center, let's say 1, 2, and you don't have that vaccine available, the next time I'm not coming.
Right. Apart from the issues, folks, with vaccine hesitancy, right, there's a lot of, should I say, misinformation about vaccines, which fuels and maybe reinforces vaccine hesitance or resistance. Both my guests in the studio have emphasized the benefits and the cost effectiveness of immunization programs. And so there's a lot to, talk about to ensure that these are available, to ensure that when a child is born, the routinely administered vaccines are available for that child. And Eunice also spent some time talking about how to reach areas. Accessibility is not just geographic or physical. It can also be financial. So you find that there are certain subsidized processes and many other things that we rely on our governments in partnership or collaboration with donor support to provide for us. So part of this week is also being used to raise the issues around this. And if you have questions and concerns about that, or even about immunization, vaccination, some even bring in the word inoculation, right? But essentially, we're seeking to protect you by introducing an agent into your body to trigger your body's own defense mechanisms. Your own immune system will be triggered into action to make sure that you are protected. Once you develop those antibodies to fight that disease, then that gives you or confers on you some protection. This one says, hello, good afternoon, Mr. Nortey and Ultimate Health team. Please, education and health are fraternal twins. Please, when is the next immunization week and month this year? Please, are we no longer immunizing our children under 5 against the childhood killer diseases? This is from Pa Solo in Sunyani. We still are. There may be challenges, but we still do routinely immunize children, and Eunice will speak to that in a second. WhatsApp 05511119997. You can send your questions. We're live on Facebook and YouTube. This is Ultimate Health. We're discussing World Immunization Week, and we're highlighting the issues related to vaccination immunization. If you have any questions, concerns, experiences, share them with us. Shortly, I will activate the phone lines. This one says, no, this is not to us, or is it? Okay. Right. Okay, that wasn't to us. I saw another message I hadn't read. Okay, I'll come back to my message. Eunice, any comments so far? I mean, somebody's asking about the next immunization week. Have we stopped doing routine immunization for the 5 killer diseases? There's been an expansion in the number of vaccines available. So if you're even still talking about the 5, then maybe you're a bit in need of an update. But Eunice, any responses to that?
Yeah. Thank you. We are still having the routine immunization.
Okay.
So you can go to wherever we have the CWC, which we usually call the weighing for the routine immunization.
Okay.
So every child below the age of 2
Right.
has a vaccine to take at certain age.
Right.
When you go, the nurse will examine the baby and determine which vaccine they are to take.
Okay.
If they have taken all age-related vaccine, they will inform you. If they have not yet taken, the nurse will recommend what they are supposed
If
to
they
take.
have missed the vaccine, if they are late,
There are some you can take even when you miss the schedule.
okay.
But there are some you cannot take when you miss the schedule.
Okay.
So going to the nurse will help you know whether your child is up to date.
Okay.
If the child is not up to date, what is left for the child? If is it possible for them to take at the age you have gone,
Okay.
they will give to you.
Okay.
If it is not possible, they will get you informed and give you what is appropriate.
Okay.
The week we are celebrating. And then for the week, they are organizing DEBA.
Okay. I've given the dates. Just confirm for my listeners. I said 24th to 30th of April. That's
Yes.
the week.
Yes,
As
please.
being observed.
Yes,
Okay. So for
please.
the Pasolo, the immunization week, right, is on as we speak.
Yes, please.
Okay. Does that mean that there's active mobilization of teams to go out into communities and immunize, or is it just a celebration?
There is active mobilization. So teams, that's why we are here.
Yes.
It's part of the
I know.
mobilization.
I want you to confirm, because sometimes our listeners get a bit confused. They think maybe we are celebrating, there'll be brass band, there'll be t-shirts and all that, and then maybe the immunization will follow later. So I want to confirm what is going on the ground in Ghana currently.
So on the ground, we are doing mobilization. They are doing education at churches. They are using the CIC. They are using DABA. They are using education at the facility, I mean the hospitals and the clinics and then the polyclinics.
Okay.
They are doing sensitization at the OPDs and wherever they can meet people to inform them and explain to those who have concern. You mentioned misconception, misinformation. So we use this opportunity to explain to those who have issues what the issues are,
Okay.
for them to understand and make informed decision.
All right.
So
you are not, hang on a sec. When you say informed decision, informed consent, after the explanation you have understood, and then you decide to have your child
immunized.
immunized. So you are not being forced.
No.
right? Your child is not being forced.
No.
Right. Okay. It's an important point to underscore, reinforce that you will be given information, right, to assist and facilitate your decision making
Yes.
for the protection of your child
And society.
and society.
The unfortunate thing is that when your child gets it, the disease is not limited to your family. That is why the society is concerned, or the government has a concern to ensure that every child in the age group
Age bracket, yeah.
has the expected immunization age appropriate.
Okay.
Your child pickup of polio can bring about outbreak of polio in the whole of Ghana and beyond, especially when this day movement is such that somebody can eat breakfast in Accra and eat lunch in Cotonou or Nigeria or
There's
South
a lot
Africa.
of movement across the
Movement across the continent.
And indeed
So
the
you
world.
can pick it here and send it somewhere. So we are all working together to ensure that your child doesn't become the source of outbreak for the whole world to be battling.
Okay. And many of you, my listeners, will recall that some years back we had an outbreak of wild polio in Nigeria because there were certain communities that were resistant to vaccination, indeed refused, and that broke the chain of protection that had been well established and achieved over the sub-region and beyond. So it's important. And what Eunice is saying and emphasizing is that you and I are stakeholders in immunization, vaccination, and the protection it confers on us. So once you've been informed, the expectation is that you make the appropriate and the right decision and have your child immunized to extend the protection and cover that these expensive vaccines give us. Right? If you have any questions, concerns, WhatsApp is 055 1111 997. We're live on Facebook and YouTube. Let me announce the phone line 030 221 6541. 030 221 6541. The program, as always, on a Sunday afternoon is Ultimate Health with me, Nortey by Nature, on Joy 99.7 FM. We're looking at the issues relating to and surrounding immunization, vaccination, as part of World Immunization Week on Ultimate Health.
Nortey, please, can I add something to
Yes.
what Madam Eunice just said? Just to say that, so the immunization, the World Immunization Week celebration is a yearly thing. So every year, the last week in April has been set aside for this celebration. And like she rightly said, it's just to create awareness and also collaborate with key stakeholders to look at what the successes has been and what the challenges are.
What have we achieved and what are the challenges?
So that we could work around the challenges and make it better.
Okay, great stuff. 35 minutes past the hour of 2 on Joy 99.7 FM. Ultimate Health. We're talking about immunization, if you prefer, vaccination, right? Protecting yourself. And we start this with children. Eunice, let me just come back to you before I come back to the advocacy that is run by Hope for Future Generations. We typically start protecting young children, right? Even from infancy or even as babies. I got this from Steve in Somanya asking, what age should you be sending your child for weighing? Okay. Most people call the whole show weighing, right? Yeah. So let's explain that. I can explain, but I want you to explain what he's saying. At what age should you present your child for weighing? And this is a very important question because you see, when women are pregnant, we have high numbers attending antenatal. As soon as you have delivered, it's a bit different. We lose numbers. It's an empirical fact, though we do a lot of education. So at what age should you present your child for weighing, Eunice?
Thank you. One, the moment the woman delivers, they give the BCG.
Right.
Which is the first vaccine.
What is that for?
It is that one works against polio.
Right.
Then after that 4 weeks, the woman has to take the baby to the weighing, as you mentioned. And there are a number of drugs the woman will be given at the 4 weeks. and another 4 weeks the woman will go back. So they have schedules. So when the woman goes to the weigh-in, depending on what age she brings the child to the weigh-in, the nurse will give a schedule for the next weighing session.
Okay.
Sometimes on air like this, I don't want to be giving specific date because people take it and misinterpret
Right.
the information. So after you are discharged from the hospital, the nurses will tell you when you should visit weighing.
Right.
But if for nothing, 4 weeks you should be at the weighing
Okay.
to start with. And you see, one thing that many of us are not looking at is the immunization is not just for the child. As you said, it has saved a lot of children from dying or becoming sick. And as your children are sick, you may not have the opportunity to work. The mental trauma, the financial stress, the psychological stress for you and the child. And this reflects in your work, your ability to do whatever you do to earn
Right.
income. It affects the whole family. And if you, whether you are working for yourself or you are working for somebody, those other people are also affected. Even if you are selling in the market, it means those who buy from you will now go to the market and you will not be available
Right.
to serve them. So your refusal to serve your child with the right immunization to build him or her body for a healthy living affects not you alone but society as a whole.
Right.
So it is very important for everybody to take immunization very serious. Yes, we have cases where people complain, when I give my child immunization at certain time, the child cried the whole night, the temperature was high and I could not sleep, so I don't want to go back to immunize my child or vaccinate my child. Or when I give birth to the next one, I'm not ready to send the child to the weighing for the vaccination again. But the fact of the issue is, for every vaccine that we use, the vaccine is to generate the symptoms of the disease.
Right.
Then the body
Will
sensing
Yeah.
those symptoms will build the immunity. So the temperature and then the crying, because the baby cannot speak. So the only way to express the discomfort is to cry. So the temperature and those other discomfort tells you that the vaccine is working and the child is developing the expected antibodies
Right.
to get the body immunized against any disease that the child has been vaccinated against. So if you see that, that doesn't mean that the vaccine is not good. So that goes to tell us that even the adult vaccination, where people complain about weakness, tiredness, and so on, it tells you that that is what the disease would have done to you, or
that's
worse.
your body fighting to a safer, weakened, should I say, dose in quotes
Exactly.
of the pathogen.
Of the antigen.
Yeah.
The antigen.
Yeah.
So with that, the children were not able to talk, so they couldn't tell us. And the people who are producing the childhood vaccine are the same people producing the adult vaccine as well. So when this happens, it helps the body to build the antibodies to fight the disease for you to become protected against the vaccine.
Right.
And when you don't have the numbers getting the immunization, we have something we call herd immunity. It means that about 90 to 95% of the people, target group, have been vaccinated and they have developed the antibodies. So when you have a case and somebody is exposed to the pathogen that causes that disease, the disease doesn't have the opportunity to spread and then overcome people and cause the mortality and the morbidity that it would have caused. So it breaks the chain of spread. That is why it is very important for us to have a certain percentage of society immunized against a particular condition of disease.
Okay, thank you so much, Eunice. And if you just joined us, we're still talking about immunization as part of World Immunization Week, right? Celebrated now, at least currently underway, 24th April to 30th April. It's an annual observation. It seeks to make everybody aware of the issues, of the availability of vaccines, of the safety of vaccines, of the responsibility of each and every one of us as stakeholders in, should I say, global protection and wellness. So that's why I've got Gladys and Eunice in the studio. Gladys is with Hope for Future Generations. They do a lot of advocacy work around vaccines, immunizations, and many other things. And they are particularly interested and have been running a program, the FAIR program, which is about financing immunization advocacy response, making sure we keep our governments on their toes with regard to the issues surrounding immunization, the issues surrounding the finance path, right? The source of finance to secure these very, very critical and crucial, let me call them medicines in a sense, right? For each and every one of us, okay? So, Gladys, I mean, so what have you been doing? And I know you can speak quickly to the press release that you issued to government as part of activities for this week. And then when I come back, we'll look at some of our challenges with the expanded immunization program, which celebrates its 50th year.
Sure.
Right.
Thank you very much. Yes, so for
Let me just remind listeners, the phone lines are open 030-221-6541. WhatsApp is 055-1111-997. And you can send your questions there. Steve from Somanya gets back to us whilst Gladys is preparing to respond. He says, my wife has stopped taking the baby for weighing since he turned 2 years of age. For misplacing the record book, is it a healthy practice? His wife has stopped going for weighing, and I think it's on account of misplacing the weighing book, right? Esther, any comments quickly to Steve? Then I come back to Gladys.
Thank you, Mr. Nortey. You see, it's better she goes back and have a new card prepared for her, and all the other vaccines the baby had been given will be entered into the new card. Other than that, at a later age in life where maybe you have moved from the area and documents have been transferred to archive and so on,
Right.
the child will need that weighing card to make certain moves in life.
Right.
And when that time comes, you put the child into trouble.
It's an important part of your
It's
medical
very,
history,
very, very important.
whether
Some
you were
of the
vaccinated or not.
Exactly. Some of the places where you are even traveling, they will ask for your weighing card. So the weighing cards are very important, and people can tell you the frustration they have to go through to get a weighing card. So I encourage my brother to tell
Wifey should go back.
wifey should go back. Since it's the same community, they can give a new card and document all the necessary vaccine they have taken, and because now the document is fresh and can be retrieved easily.
And records as a country of the numbers, the ages of
The
those.
vaccine, we
important.
have numbers on the vaccine,
Yeah.
so they are very important to be documented. If you don't go now, you may not get it. And then at 2 years, we have a lot of the vaccines that have been given, but it's not ended to 5 years. So wifey has to continue till the child is 5 years. He has other
There's a lot
vaccines
to be done for this child.
for this child till
Right.
5 years.
Okay.
And that is where we are having a challenge now, because most of the children by 1 year or 6 months they are in school. And then the parents are also not giving the school authority to allow health workers to go to the schools to vaccinate the children.
Right.
So we are missing out on the
So
children.
we've got a whole load of stakeholders we should be talking to
Exactly.
and drawing into this dialogue.
Exactly. So
Right.
we want to use this opportunity to reach out to parents. When they go to the PTA meeting, they should find out whether their school is being attended to by health workers in terms of vaccination of their children.
Okay.
If not, they should have a discussion with the school management and contact our people. They will schedule a time. They will come.
When you say contact our people,
Contact
the
health,
ministry.
Contact health directorate or any health facility close to them.
Okay.
Uh-huh.
Okay. Let me
Any
announce
health
the phone
facility.
lines again. 030-221 6541 0302216541. Those are the healthy buttons to push. We're talking about the World Immunization Week, and we're getting into some of the crisscrossing issues that come up, right? Presenting your child, understanding that this is something that you must grab for your child and make sure your child has that protection, okay? In the absence of that protection, or in the absence of a full cover, then there are many risks that your child, your community, and indeed the nation and the world at large stand to encounter. So make sure this is important. The record card, we used to call it something, and then we modified it a bit. What were the women calling the card?
Roadmap.
Roadmap.
The
weighing card.
The weighing card.
Then
We
it was
also call
modified
it-
a bit a couple of years back.
Yes.
Yeah.
Now we have the maternal record and then that of the child, in the same book.
Yes.
So when you pick a child's book, you see the mother's record. So when you need to trace certain condition, it's easier
It's
for
easier
you
to
to
do.
assess the child holistically,
Right.
and attend to the child.
Okay.
So that is the.
All right. Steve, thanks for sharing that. But hey, the men are involved, should be involved. Okay. He's talking about his wife as if, I don't know. But that linkage is important. The men are part of this process. They may not physically present at weighing, but they should know what's going on, and they should support their wives. Of course, you
but
might.
this time around, they are being encouraged to be there physically.
Yeah, if you can be there physically. And I hope they are being made comfortable. You see, when you get there, I know because my home has been a maternity home for many years, right? But when you get there, it's the women and the white and all this. The men don't tend to feel comfortable, but they are being encouraged. Let me quickly read this and come back to Gladys to speak a bit more about...
Maybe before you read that, for us not to forget, the men we are encouraging to come. So when you come with your wife, both to antenatal and then weighing, you are giving attention, priority. So you'll be treated, your wife will be treated fast for you to take your wife away. So you don't follow the queue.
Okay.
So it's good for them to come with their wife so that their
You
wife...
give priority to couples.
Yes, women who come with their partners.
Oh, wow.
You'll be treated immediately.
So
you
your
come.
husband is the password.
Yes, it's the password for you to
move quickly.
To move quickly. And the other thing, just as you said, is you see, we are struggling with centers for doing this weighing. Some of them are being done under tray, and there are no seats for the women to sit down and have their services done to them. So if you come with your wife, you also see that the women are struggling, and you see the importance of us helping to bring about some comfort at these weighing centers.
Right.
Maybe you are in an organization or a church leader with some space in your church. You can offer to the health service to come and have some seats for the women to carry their babies. That is also deterring them. You come with this baby who is a year plus, who wants to move around, who is heavy, and you have to carry by the side till you are attended to.
I don't want you to even think about twins.
So you said it.
Right.
So if they are twins and you have come with one at the back, one at the shoulder, and you are waiting, standing with these children, it's uncomfortable. So we are calling on everybody, if you have space in your house that you can offer, that we can do the weighing there, where we have some seat for the women to sit down, it will help a lot to prevent the women from shining the weighing centers.
I hope this goes down well. Good afternoon, Nortey. How are you and your invited guests? Once again, thanks for all the education about Immunization Week. My question is that what is the full meaning for the word polio? Right, poliomyelitis he's asking about. Why is it that it affects a certain range of children from 0 to 5 ages? Okay, I'll hang on to that. This is Hayford in Bator. Dede in Maryland has typed plenty. Yellow fever, is it for 10 years or for life? I understand it used to be for 10 years and recently it's been circulated that it is for life. How many years can one save that yellow card for 10 years or for life? I lost my card and I don't have proof that I've been vaccinated. Do I have to take it again? This adult vaccination, she's talking about yellow fever, what we call the travel card, especially, that has your record. Any side effects for taking it twice or more? Is Ghana enforcing one to show the yellow card upon arrival? She's in the US. Okay, a whole load of questions that will derail us a bit, and I know how I'll package that. I'll bring my guest back and add an additional guest to deal with some of those issues.
I'll
as well.
just give a quick answer.
I want to give Gladys a bit of space to speak about what their concerns are as HFFG. Right. Just quickly, you've issued a press release. What are your key concerns for this year's celebration?
Okay, so thank you very much. So for this year, we have series of activities we have lined up for the week, and today we are here discussing the immunization week. It's part of the activities that we have planned. Like you rightly said, the press release, and what we are seeking for is still on domestic resource funding for immunization. And so the gist of the press release, if you have read through it, you will notice that the main theme is that government should release funding for immunization in Ghana, and that we don't want to see any shortages. We don't
There
want
are several years that we have defaulted as a country in paying up our domestic component. The foreigners or the donors give us a certain amount of support, and we're supposed to complement that as a sovereign nation. Okay, so your press release is hitting on that and making sure that we come up to speed and we are update in our payments as a country.
Exactly.
So this is targeted at government.
At government.
Okay.
So timely payment is very, very important. Like you rightly said, some years back, 2018, 2016, I think we defaulted as a country in paying our co-financing obligation. Let me say that as at last year, we did well as a country, because initially the plan is such that by the first quarter of every year, government is supposed to pay upfront 100% of
in
your
advance of the co-financing.
By the first quarter you pay, so that the vaccines will be released by the donors. What happens is that sometimes government will sit and do the payment maybe in the last quarter of the year, or even the whole year, government will not do any payment and rather pay in the next or ensuing year. And that does not really help us as a country, because we are depending on the donors too much. And we think that, in our press release, we even stated that by the year 2027, Gavi will exit from Ghana. Their support to us will end. Are we ready as a country to own the vaccination program 100%? That is food for thought. Okay.
So do we have the capacity to protect our own children ourselves?
Exactly.
Right. So Hope for Future Generations is keen on this advocacy, right?
Exactly.
And is pushing this message. Have you had any response?
So far, I think the response we've had is good, because we have engaged some key
How are we
stakeholders.
what is our standing as we speak as a country? Are we passed the first quarter? Are we up to date in our?
Yes. So for this year, for example, government has done, let's say, 30 to 40%. There's a bit of debate on the percentage, because there's a way of calculating it. So, but let's say roughly around 40% has been done.
Oh, that's great.
Which is great. So we have roughly about 60%
But we're
to do.
supposed to be 100%.
100% by the first quarter of the year. We have done 40%.
Okay.
We still have 60% to go. So we are still hitting hard for government to release the remaining 60%, so that at least we know that for this year we have done 100%. Whilst we also plan for the exit of Gavi, because we know that by 2027 they are moving out.
We're not going part of that
exactly,
program.
and there is the need for us to put in place a roadmap. as to how we are going to finance
Okay.
immunization ourselves.
Right. So money is involved, even though we're talking health. Money is important. Eunice, I'm looking at you because you sit with the public service. So I know you have a great partnership with the NGOs. But some of your challenges, if we can do a few of them, I'm thinking of bringing you back next week so that we can do some of the more practical weighing immunization and other issues properly, right? But what are the challenges? I mean, you roll out the service and you provide the immunization. Are the vaccines available? The key ones, the salient ones that you need, are they available? And Dede, by the way, I'll package your questions. We'll do a full program on proper immunization and stuff, all the yellow fever stuff you asked. Okay. Yeah. Are they available? Right?
Thank you.
Are you able to roll out these weeks and the various other campaigns that you do in a timely, routine basis?
One, we've had vaccines availability better before COVID-19.
Okay.
But after COVID-19, with its pressure on production and factories, and then the pressure to produce the COVID-19 vaccine to save lives, the production of some of the vaccine went down.
Okay.
And in addition, our procurement, just as my sister said,
Right.
also became
A bit
an
problematic.
issue.
Right.
So because of that, for some time now, we have not had vaccines consistently. You may have some may not be there, but when we have vaccine, we make sure we reach out to those who need them.
Okay.
And we don't get any wasted. Then besides the vaccines inconsistency, we also have the issue of space to deliver the service.
Okay.
It's a big issue that we are struggling with, especially in Greater Accra. You know, besides the well-developed areas where we don't have government facilities, we have a lot of private facilities in Greater Accra. We don't have government facilities. So where the government staff who do this immunization, usually we call community health nurses, will carry out the immunization in the communities, is becoming a problem.
Right.
They work under trees without chairs for they themselves and even the mothers at some of the places. Then we also have a situation where, because they don't have a stationary place to do the thing, like a building to work from, they have to be picking their logistics in and out every day.
Right.
And it's stressful because you look at the vaccine, the documentation and all that they need to go, the weighing machine, even the one to use for their the measuring of their growth, the length, infantometer, and all those things, they are heavy to carry around. So we don't also have sufficient vehicles in the service. Sometimes a whole district with one vehicle, and you can imagine the
many of you go on foot.
Yes, you see them carrying the things, and
I know.
Around. So that is also another issue.
Okay.
So with this, we have newly developed areas every day that these our officers have to go and be checking on the expansion of the towns to see where they can
Possible locations to deliver these immunization services, weighing, etc.
etc.
Okay.
And sometimes when you are contacting people or places you think can be used, it becomes difficult for some of them to see the importance of this to give us a space to work with.
Okay.
Some are thinking you have to come and pay. The officers don't have the money. They can't pay for space, but they need to bring service to the doorstep of the people.
Right.
And the worst of it is now most mothers are working, so they leave home very early and come back late. So during the day they are not available to send the children to the vaccination centers.
Okay.
So they send them to school. How do we get the schools to agree for the officers to come and do?
Lots of issues.
Lots.
Eunice, I empathize with you both, and but you see, we try very hard to use our platform to bring these issues to the fore. As a son of a reluctantly retired midwife, my home has been a weighing center and many other things. So I know the struggle the nurses and others go through, carrying their stuff, arriving, providing furniture and all those. We'll take a look at some of these practical issues in subsequent weeks. We've already crossed our closing time of 3 p.m. Many thanks to you, Eunice and Gladys. We'll come back to some of these issues, right? Do we have the wherewithal, the resources? Are we prioritizing some of these critical services that have to be delivered at critical times and ages and developmental stages? So we'll come back on these issues with both Hope for Future Generations, with the Ghana Health Service. We do a lot with health promotion. I don't think, Eunice, have we met before?
No.
We haven't met. Okay, I know some of the others from way back. It means I'm getting old. Rebecca in Frafraha says, Nortey, well, thanks so much for the education. Very instructive. Well, this and every Sunday, 2:05, this is what we do. Produced by Abeku-san Kofi, and the dial, as you know, is Joy 99.7 FM. Stick and stay. We're done for today, but we're back next week, God willing. Don't go anywhere.